All right. Thank you. Thank you so much for being here. When John suggested this event in December for mental health, I thought about it a little bit, and I'll set that up in a minute, but I said, hey, John, are you sitting down? Are you ready to talk about this concept of psychedelic medicine? So here we are. I was pretty nervous about introducing this topic to the chapter, right? And what I might be saying, what I may or may not know about this topic. And also the challenge of, this is the off season, right? We've not had great turnout for events. I think the last one I did, we had 15 people or so. So to look around this room tonight and see that it's kind of standing room, and I still have people banging my phone right now asking if they can crash the event. It's pretty amazing. So thank you all for coming in, and Casey coming from California, George coming from the UK, and Rick all the way from Tel Aviv. Unbelievable. And a little bit of the genesis of the event. John mentioned Michael Pollan's book. I've studied and read everything you could possibly read in psychedelics since I was in college, and very passionate about it. And then the Michael Pollan book comes out, and kind of here it is in mainstream. It's on 60 Minutes and New York Times, it's everywhere. Then a local friend, Glenn Larner, who couldn't be here tonight, calls me up and says, would you like to have dinner with Rick Doblin? I said, are you kidding me? And so Julie, my lovely wife, and I went to Cash with Glenn, his wife, and Rick and Jade, and we had a 3-hour conversation over dinner. And when Julie and I walked out, our jaws were on the ground and said, how are we going to be a part of this? How are we going to, be a part of what can possibly change the world? So that's why we're all here tonight. And I do need to read off this a little bit because Dick Simon is not here. He was our opener. Like I said, the founder of the Psychedelic Medicines for Mental Health group. Yeah. So I'm going to just tell you a little bit about him. He's the founder of that group, co-founder and chairman of the YPO Peace Action Network, and chair of the YPO President's Action Network chapter. He's been working to shift public perspective and reduce stigmatization related to the use of psychedelic medicines, and is also working with researchers studying treatments for a wide range of indications, as well as their possible use in conflict resolution. So Dick's going to arrive at 10 p.m. tonight if his flight mechanical is addressed. So if you're out, maybe you'll have a chance to meet him. And with that, because we've had this change in the program, I have to thank Casey for picking up the slack here. She was not going to join until after Rick and George, so she's going to lead us now. And for those of you who don't know who she is, and she typed this up for me just a little bit ago so I could read it. But obviously a former resident of Aspen. She met her husband here, who's also with us tonight. Deep family ties to the Valley. She's a practicing psychotherapist, wellness educator, and clinical supervisor in Los Angeles, and she has recently undergone and in the process of training with MAPS in psychedelic-assisted psychotherapy for the treatment of PTSD. Her work challenges old mental health paradigms. She's an advocate for alternative approaches of the treatment of PTSD, anxiety, depression, and addiction. So it's my pleasure to introduce her as the moderator and participant here tonight. Thank you.
Hello, can you hear me? There we go. So I am really happy to be here. It's kind of a homecoming. I don't get to come to Aspen as often as I once did. I love it here. It's so beautiful. And I have the pleasure of introducing you to our presenters this evening, both of whom I've had the chance to spend time with outside of this evening. And they're both wonderful, compassionate, kind, thoughtful people who have an intention to really make a difference on the planet, which is something that we need, obviously. So I'm going to start by introducing Rick. Rick Doblin is Executive Director of the Multidisciplinary Association for Psychedelic Studies, MAPS, which he founded in 1986 and grew into an international psychedelic pharmaceutical company with over 50 staff. MAPS, which designs and sponsors psychedelic psychotherapy drug development research, received FDA breakthrough therapy designation for MDMA-assisted psychotherapy for PTSD in 2017, with phase 3 clinical trials underway and FDA approval anticipated in 2021. He received his doctorate in public policy from Harvard's Kennedy School of Government, where he wrote his dissertation on the regulation of medical uses of psychedelics and marijuana in his master's thesis on a survey of oncologists about smoking marijuana versus the oral THC pill in nausea control for cancer patients. I am especially enthusiastic about the possibility of expanded access taking place in 2021 because I am a recently trained psychedelic therapist who will get to facilitate the treatment. George Goldsmith, to my left, is the Executive Chairman, Chief Executive Officer, and co-founder of Compass Pathways. Founded in 2016, Compass Pathways' first major initiative is in developing psilocybin therapy through late-stage clinical trials in Europe and North America for patients with treatment-resistant depression. Compass is taking a new approach to mental health and is committed to developing care pathways and therapies that will help patients and their families and ease the burden on healthcare systems. Backed by a team of leading experts in medicine, mental health, business, and academia, Compass puts the patient at the center of everything they do. George is a serial entrepreneur with significant experience in pharmaceutical regulation. As a member of the Young Presidents Organization and its International Board of Directors, George founded YPO Networks. So, without further ado, I'm going to pass the baton to Rick, and I am going to lovingly interrupt him in 20 minutes because he has so much to share. So.
Is mine working? No.
It's a little low, Rick, if you want to maybe bring it up, it might work.
Is that any better?
Yeah.
Okay, well, if I don't need. All right, well, it's a pleasure to be here. I did fly in from Tel Aviv, where I was at the World Psychiatric Association Conference on Spirituality and Mental Health. And we're doing a lot of work in Israel. We actually have 70 employees now at MAPS and the Public Benefit Corp, so it's hard to keep track of. And the other thing I'd like to say is, Casey, that you haven't quite completed the training program. The best part coming up is we give MDMA to therapists as part of their training. So we're and we've done that for over 80 therapists so far. I want to start out just by this quest into the unknown. So my interest in this also began in college. I had been traumatized by stories of the Holocaust. I had distant relatives killed, but then I was further traumatized secondarily by the Cuban Missile Crisis and learning about if I just hide under my desk and the bombs go off, I'll be fine, which was not very reassuring. And then I was realizing it was my own country in Vietnam. So I was a draft resistor in Vietnam, preparing to nonviolent resistance, preparing to go to jail. And my parents were very sympathetic with that, but they said, you're going to be a felon and you're never going to be able to have a real job because you're not going to be able to get licensed for anything. And I said, well, I accept that. I'll have to do that. I never registered, and the government never figured that out. So actually, nothing ever happened to me. And then Jimmy Carter pardoned all the draft resistors on the first day in office. So it was at age 18 that I was really exploring LSD, and whenever I would trip, I would wear a T-shirt that had the quest into the unknown that a friend had given to me. And it was then at 18, after my own experiences, that I really thought that psychedelics and the psychedelic mystical spiritual experience and the way it helps you process and become emotionally more open, that was the solution, or the key, one of the solutions towards a more peaceful world. Is basically, I was just at the conference in Israel, someone was presenting about the genetics of mental health, and they said that genetically we share 99.9% of the genes with all humans, and it's 1/10 of 1% that makes us unique and different, and yet that's what we kill each other for. So if we can understand how we're all connected, then I think we'll be more grounded, and that's what really drove me to focus on psychedelics, because there are many ways to do that, to have that experience, but psychedelics have been used for thousands of years for that purpose, and it's more rapid. It needs to be integrated, but it felt to me that psychedelics would be the key. This was from an article in the Boston Globe. It was called Lucy in the Sky with Doctors. But it said, as the marijuana debate shows, attitude shifts that barely seem possible can sometimes become inevitable. And that it doesn't feel, either to me or probably to George, that it's inevitable, but it feels like we've got a real good chance at really developing psychedelics into medicine, and then going beyond that into having our culture really accept them as tools in a wide variety of contexts. So MAPS is actually now 2 organizations. The first is the nonprofit MAPS, which I started in 1986, 33 years ago. And then 5 years ago, actually in December of 2014, we started the MAPS Public Benefit Corporation. In anticipation of the possibility of succeeding and actually having a product that we could sell as a medicine. And to do that, I realized we're always asking donors for money, and yet we're one of the rare nonprofits that's talking about having a product at the end that we could make some income from. So I realized that if we could do that, that would be a different kind of story that we're telling to donors, help us, reach this point where we then can generate some of our resources through the sales, but that's taxable. And so not only do we want to demonstrate a new approach to mental health, psychedelic-assisted psychotherapy, but we want to demonstrate a new way to market pharmaceuticals, which is the Public Benefit Corporation. So it's modification of capitalism, where you maximize public benefit over profit, but you still make profits, and it is a for-profit company. And the research portion of our staff works for the Public Benefit Corporation, and that's where we're going to sell MDMA. But it has only one investor, which is the nonprofit. So we're doing this all in this nonprofit way. It's possible because of what Ronald Reagan did in 1984, where he signed a law that developed incentives for developing drugs that are off patent. MDMA was invented in 1912 by Merck, and so it's in the public domain. So what Ronald Reagan signed into law was a program called data exclusivity, which means if you're the first sponsor, and Compass will be using this in part for psilocybin, that if you make a drug into a medicine that's off patent, no one can use your data to market a generic for a certain period of time, 10 years in Europe, 6 years in Israel, 5 years in America. And if you do pediatric studies, which we're now being required to do if we succeed in adults, you get an additional 6 months data exclusivity, and a generic manufacturer cannot even apply until that 5.5-year period is over, and it takes FDA at least 6 months to review that. So we'll have more or less 6 years of data exclusivity. Some other sponsor could make MDMA into a medicine for PTSD because it's not patented, but it'll take them 6 years, and probably they won't do it. They'll just wait for our period of time to expire. This is sort of the future vision of MAPS. MAPS nonprofit at the bottom, and we have the Public Benefit Corporation. The dark lines are things that we own. So we have a MAPS Europe corporation that we needed to negotiate with EMA. Future global companies, we're going to be starting a MAPS Israel. And then the Public Benefit Corporation is going to be running the expanded access to compassionate use and trained therapists. But we could potentially create more benefit corporations for cannabis, ibogaine, and ayahuasca. We're going to leave psilocybin to George and to USOTA and other groups. But this is the potential in the future for how we could grow. And the idea is really trying to create, it's not so much about MDMA or psilocybin, it's about psychedelic psychotherapy. And the psychedelic psychotherapists of the future will have all of these different drugs to use and to apply according to their clinical judgment when the patients most need it, what they're most needing. There are now 4 groups that are nonprofit psychedelic research. MAPS started in '86. Hefter in 93 after a meeting at FDA in 92 where they said they would open up the door to psychedelic research. The Beckley Foundation out of London is 1997. And then USONA was founded in 2014 to sort of pick up on Hefter they were academic researchers. They didn't have the skills to really do drug development. And so that was taken over by USONA in 2014. Then there was George and Katja created Compass in 2016, also to work initially on psilocybin, and then Janssen founded in 1886. But they're the ones that just put ketamine, S-ketamine for depression, and just obtained approval for that. And there are other for-profit actors coming into the story to try to do various things. This is a slide just to give you a sense of how much has changed. It's a very psychedelic slide. Maria Sabina, who introduced psilocybin to the West, some mushrooms, ayahuasca. The main point of this slide, this beautiful looking slide, is it was created by the FDA, by the FDA Division of Psychiatry Products that they presented at the American Society for Clinical Psychopharmacology. So when the FDA is creating psychedelic slides, you know something good is going on. And they also announced there that they're going to be creating a guidance document for psychedelic research. So there's over 3,000 guidance documents that the FDA has on all aspects of what you do. There's the laws, the regulations, and then there are guidance documents that are not requirements, but they're best practice suggestions. So they're going to be working with all of us to try to develop that for psychedelics. This is another sign of progress. Sarko Gregorian is actually a police psychotherapist who is going through our training program. And he's wanting to provide MDMA-assisted psychotherapy to police with PTSD. And we had a meeting with police. He's from Boston, so we've had time to get together in person various times, and then he introduced me to his police chief. And a week later, he called me to say that he'd gotten permission to go through the rest of the training program where he gets MDMA. So we are now dosing the police with MDMA. And then this is also my TED Talk. I went there to see how it was doing, how many people were watching, and I saw that the NSA was advertising for future spies on my TED Talk. And I'm like, if that's not a sign of mainstream acceptance, I don't know what it is. Now, I think they had a deal with TED, and they appeared on multiple different talks. And I wonder if anybody who actually watched my talk will apply for it. Developed holotropic breathwork, who was sort of world's leading LSD researcher. And it was at the same time that MDMA had already escaped from the underground therapy community and was also being sold as ecstasy. And that was during Nancy Reagan Just Say No, escalation of the drug war. So it was clear that it was doomed. And so I started a nonprofit before MAPS. We started organizing the psychedelic community to prepare to defend therapeutic use of MDMA once the DEA would move against it, which we knew would be inevitable, and it did happen in the summer of '84. And so there's a picture there. You can see there's a person taking the picture. That's me. That's right before I walked into the DEA headquarters to file for an administrative law judge hearing. Took them totally by surprise. We had a 30-day public comment period. I walked in day 28, and I said, here's our lawsuit, and we're going to try to use MDMA legal for therapists. And we ended up winning in the court of public opinion. We had Rabbi Zalman Schachter compared MDMA to the Sabbath. We had Brother David Steindl-Rast said that MDMA gave you the same enlightened attitude a monk would spend his whole life in a monastery trying to get to. We had Lester Grinspoon from Harvard Medical School, and we were also winning in the courts, and that freaked out the DEA. So in '85, they emergency scheduled MDMA before the hearings were even over. It was kind of heartbreaking. As it turned out, they didn't have the authority to do that, and so the first move to criminalize MDMA was a crime. And those people that got arrested in the first year were all let go. The Attorney General had the authority, but never subdelegated it down to the DEA. So this was heartbreaking. The judge later came out and said MDMA should be Schedule III, means it should be a therapeutic drug. So in that recommendation was rejected by the head of the DEA. So in '86, I started MAPS. And thought this is going to be a psychedelic nonprofit pharmaceutical company. And to telescope, and because I only have 20 minutes, 30 years later, we had our end of phase 2 meeting at the FDA. where we present all of the research that we've been able to gather in that 30 years and say, we want to go to phase 3, the final stage of research to make a drug into a medicine. This is the data that we presented. We have basically a 3.5-month treatment program. People get MDMA 3 times only, once a month, with 12 non-drug, 90-minute non-drug psychotherapy sessions, 3 before the first MDMA for preparation, 3 after each MDMA session for integration. And we compare therapy with either inactive placebo or low-dose MDMA versus therapy with full-dose MDMA. So the phase 2 data that we presented, and this is chronic, on average, severe treatment-resistant PTSD people. So the hardest cases, we also let people in our studies who've attempted suicide in the past. Most PTSD studies exclude people who've attempted suicide. We showed that 23% of them at the 2-month follow-up after the last experimental session, 23% of the placebo people no longer qualified for a diagnosis of PTSD. That's actually really good for that group. However, when you add MDMA, it more than doubles to 56% no longer have PTSD. But the more important question is, does it last? And that's for insurance companies, but also you put in all this intensive effort. If it just fades after the drug wears off and after the afterglow, then what have you really accomplished? So we have a 1-year follow-up as well. And what we showed is that people keep getting better. 2/3 of the people no longer have PTSD 1 year after the last experimental session. And of the other 1/3, many of them have clinically significant reductions of PTSD symptoms, even though they still qualify for a PTSD diagnosis. And if we could have given them a 4th experience, that might have moved them under.
I don't know, I just got this amazing sense of just, I guess, wisdom. I really don't know.
Sounds a lot like wisdom to me.
It was really amazing. And you know, I try and think of that really rageful aspect of me. Like I can't even, I know it's there, but it just doesn't. I really feel like so much more at peace with like everything.
Great.
Like even if I try and think about Iraq and everything, like I somehow feel like really peaceful about the fact that that's my journey and that.
Yeah, thanks for sharing that.
Part of me thinking, I mean, I know this is understanding in this somewhat of wisdom, this knowledge that I have now. I mean, just asking myself that question, I feel like it's so profound that I don't think I could really forget it.
Now, this was over 10 years ago, and he has not had any more MDMA after the treatment, and he no longer has PTSD. So he didn't forget it. And also, we have 8-hour therapy sessions with a male-female co-therapy team, and roughly half the time, people are eyes closed listening to music, and they're having incredible metaphorical imagery going on, like you can see about this rageful part of himself. And the other half of the time, they're talking with the therapist, and that's a little bit different than the psilocybin. And psilocybin is more time eyes closed internal and less time talking with the therapist. So after we presented all this information to FDA, we went through this long process, 8 months, and got approval for the phase 3 protocols, and the FDA signed on to what's called a special protocol assessment. And then we have an agreement letter, so if we can use the design that they agreed on and get statistically significant evidence of efficacy and no new safety concerns arise, then they say they will approve the drug. As already went on, this is our phase 3 design. You're either going to get 3 sessions, the first with 80 milligrams, then 120 right here, then that, or you get an active placebo, and we give half the amount after 2 hours. So you start with 80 and then you get 40 after 2 hours, or you start 120, you get 60, and then the 2-month follow-up. We managed to get breakthrough therapy designation, which means it's the most promising drugs being developed by FDA. 2/3 of the applications from pharma for breakthrough are rejected, and 1/3 are accepted. George can tell you more, but he also got breakthrough for psilocybin. This is why it's a breakthrough, why we need it. There's a year ago, there was over 1 million veterans receiving disability payments for PTSD from the VA. It's about $10 or $15 billion a year. And yet we've not got a single penny from the VA yet. These are our phase 3 sites, 15 of them, 2 Israel, 2 Canada, and 11 in the United States. With George's help, then we also went to the EMA on June 12th, 2018. George is on the left there. We had a meeting about moving to Europe with phase 3, and they said, yes, we could do that. These are our countries that we're going to be doing in Europe. It's roughly $40 million to make MDMA into a medicine for phase 3 for us, and it'll only be about $12 million for EMA. And it's not because they need less information, but it's because they'll accept the data we generate for FDA. We have support from all across the political spectrum. Rebecca Mercer gave us $1 million as long as it was limited to veterans in our study. Elizabeth Koch has pledged $2.7 million, $900,000 a year for 3 years. She's really quite progressive. And then George Soros also gave us $70,000 for a training for therapists of color. Where we're at in phase 3, we've enrolled 73 of 100 participants in the first of 2 100-person studies. 7 people have dropped out, which is not a good thing. You don't want people to drop out, but it seems to us, we haven't uncovered the blind, but it seems that 6 of them were in the placebo group, and the one person that the therapist and the person thinks got MDMA dropped out because he said he didn't need any more treatment. He was healed. So that's really pretty good. We're going to do an interim analysis in April 2020 where it's like the system is designed to help you succeed. So you can have a small data monitoring committee take a sneak peek at the data, and if you need to add more for statistical significance, they'll tell me a number, either 0 or whatever the number is. And then if that goes well, we're going to move to Europe. And Europe, we have to do 70 people, and the EMA said they want us to include refugees and migrants as well in the study. These are the, and I'm almost done, these are the REMS, the risk evaluation mitigation strategies that we're negotiating with FDA. What it means is that it's not like a normal drug, that once it's a medicine, it can be prescribed for anything by anybody. This is going to be only people that are trained. So like Casey, people that have been through the training program are going to be the only ones that can provide it to the patients because it's not the drug, it's drug-assisted therapy that's the treatment. And it'll only be administered under direct supervision in clinics. Eventually there'll be thousands of clinics, at least one in Aspen. And there'll be a centralized pharmacy that shifts the MDMA to the prescriber, not to the patient. This is our big struggle with FDA right now. For psilocybin, they're requiring, of the 2-person team, the first has to have an MD PhD and training from the sponsor, and the second just has a bachelor's degree. Right now, for MDMA, we have either a doctor, psychiatrist, or somebody licensed to perform therapy, and the second person has to have a bachelor and be licensed to perform therapy or pursuing licensure. But FDA has said to us they might want to change it in the future where everybody has to have an MD PhD, or an MD or a PhD as the lead person. So we're arguing that out. This is going to be one of the clinics in the future. This is going to be another one of them. We're in the city. And so what I want to do in the last 2 slides is just thank Christian Angermeyer, who is the lead investor in Compass Pathways and Atai, the holding company. And so he wanted to he wanted to invest. He said, I'll fund all of Europe for you. And I said, no. And he said, why? And he said, well, where were you 30 years ago? You know, investors weren't there. I think 8. Yes, that's another good point. But what he said was, and what I said was, is that for whatever funds we can make, I would like it to go to other things that are non-monetizable or things that are before investors are going to do it. And he said, what's that? And I said, well, we've got this psychedelic reconciliation project. There's a bunch of Israelis and Palestinians who are doing ayahuasca and MDMA together. Quietly, illegally, but they're doing that, and that's sort of the seeds of peace. And we would like to study that. So we got a 3-year project. We got the first year funded. We need funds for the second and third, and that's not something we can monetize. And so Christian said, well, how much does that cost? And I said, well, years 2 and 3 are 100,000 pounds each. And without much thought, he said, I'll donate that. I'm not only about money, I'm about peace. And his only condition was that he wanted to be the only funder of years 2 and 3 so he could claim it was his project, which I said, totally fine. Yeah, okay, so then this is basically the team. We're doing it with Robin Card-Harris and his group at Imperial College. And so in the first year was interviews with these Israelis and Palestinians. This is the quote from what it was like to be in an ayahuasca ceremony. There were moments of love and open-heartedness that we are all together. There was no, you are Jewish, Arab, Muslim, Christian. Everything was stripped. All this nonsense was out, and only acceptance and love were present. Yeah. Yeah, thank you.
Well, is this thing on? Can you hear it, or no? Let me just try this. Is this any better? Yes. Okay, can you work that before we? Okay, let's try that. Okay, here we are. Good. It's really interesting. I didn't know you would end there because that's where this all began in a really interesting way. Yeah. So YPO Networks was born with Bobby Sager, Dick Simon, myself, and someone named Amin Hashwani in 1999, with the intention of actually having YPOers from different areas of conflict come together without MDMA. We had no idea that that existed at the point. And we met in Cyprus, and we started talking about our families, our lives. And so it's kind of this really interesting full circle moment, and that was the birth of YPO Networks. I was on the YPO International Board trying to fend off people from different chapters who thought we were crazy to do anything except talk about wine and golf and all of that. So that was the beginning of YPO Networks in '99. So I never imagined that I would be here talking about this, and yet here I am. And this came about from one of my own experiences in this area, which I will. I've had two experiences. One that my forum really knew well about, and I guess you can pick this up again because I've now shared that. My ex-wife died of alcoholism, and I had a front row seat of that. And so that was pretty intense. And then I was remarried, and my amazing wife, co-founder, had a 16-year-old son who went to university. And he was bright and everything. We were all excited, you know. And then he started crashing with depression and anxiety and OCD, and it became really difficult for him to attend classes. I did what YPOers do. How hard could this be? You know, we know everybody, kind of this YPO tendency, right? Of, well, how hard could it be? We'll just go get the best and get this solved, and how about next Tuesday? And, and it turned out not to be that. And he got much worse, and with every encounter in the psychiatry system, we kind of became less and less recognizable until he had a massive side effect on an SSRI. And then we discovered there were 11,000 other massive side effects like that reported. There's also some of those side effects manifest in these mass shootings that we've seen. It's called akathisia. And so I think that this is a really important issue to deal with. It's about mental health, it's pervasive. And so while we're talking about psychedelics, our whole focus is on this issue of the patient experience, which is quite dreadful. We went through what it was like to have inpatient experience. It's kind of like jail with different color clothes. What it was like for somebody to go through that. And so for us, what we realized is that the more YPOers I talked to and the more friends, I realized we started to share our story. Not the kind of chest thumping, YPO forum, how can we actually, be better than everyone else? But to have this really kind of deep, meaningful interaction about what's really going on in our families. And it's what forum can be when it's really working well. So lots of us discovered that everybody had kind of this secret thing in their family. So many of the people who raised their hands, right? You don't talk about this a lot, but it affects all of us. And so we realized as we were going through this that if we could do something, we had to do something. My wife's a real an activist. She's a doctor, she's a physician, she's a woman who drove on the 12th or 13th of September 2001 to Ground Zero to treat people who were doing the cleanup. That's the kind of person. So we realized, let me just go back for a second if I can go back. There we are. So everyone does have a story, and that this almost became an involuntary startup for us. I was busy for the last 6 years working with regulators, with the CEOs of major pharma on both sides of the Atlantic, with health ministries on how do we get the right medicine to the right patient at the right time at a cost society could afford, and nothing to do with psychedelics. I hadn't thought about psychedelics since I was 21, which I thought a lot about at that point. I started earlier than you did, because I was, yeah. But this was something I hadn't thought about. And my wife woke me up in 2013, having done her sleepless night things of reading medical research, which she's really good at. And she came across a study about psilocybin and OCD. And it had promise. I mean, the promise didn't last, but it had promise in a way that was unseen in anything else. And so she woke me up and said, hey, you grew up in the 60s and 70s. What do you know about this? And quite a bit. And so fast forward, I talked to friends, Bobby Sager, so YPO was core to this. And we ended up meeting all the researchers within 6 or 7 months. We had talked to Rick just as he was coming off. We did a video with you at DC. You were at Reagan Airport right after you met with the VA. Yeah. That was our first interaction with Rick in 2013. Fast forward, we did what we did. We kind of funded research. We became donors. And then what we realized is that there wasn't anybody really paying deep attention to how do you get this to patients. And more papers are good, necessary, but not sufficient. So that really led us to, given all the regulatory background I had in actually developing a new regulatory process in the European Medicines Agency with my company, of all things, that's become the widest used procedure for bringing medicines to patients. So I had this background, and then this all came together, and we just felt it was a gift to do. Now, why is every 40 seconds on this? Just to kind of put this in perspective, every 40 seconds, according to the WHO report that was done about a month and a half ago, someone commits suicide around the world. For the same period, every 40 seconds, "20 people try." Every one of those has a family. I don't know why this is doing. So this is kind of what the reality is, right? It's just, our mantra at Compass is that every 40 seconds, and then 100 million people are suffering right now with treatment-resistant depression. The 40 every 40 seconds, that's kind of the front end of that. That's when there's real desperation, right? So this is a huge problem. It's a huge problem that requires a different approach, because God knows this isn't working terribly well. Our story in psychiatry is really, I mean, they're doing the best they can, but the tools aren't really very good. The treatment resistance is a huge issue. And so we need new tools. And that's kind of what we're about, is looking for new tools. So we're not a psychedelic company. We're about innovation in mental health and developing evidence to bring innovation at scale. Even with psychedelics, we're linking it deeply with technology for predicting response. So we're really kind of taking a 21st century view of how do we develop this, given the tools, the understanding, neuroscience advances, and really looking at how do we put this into a cultural context of today and tomorrow, not yesterday. And so that's what we're doing. It's a huge problem that we have, a tremendous unmet need, and a huge cost. So just with depression, it's just depression, it's a 300 billion pounds. So I know we're trying to get the pound to be closer and closer to the dollar every day, but we're doing that. So it's 300 billion pounds of cost just associated with depression. A huge, huge number. So what if you make a little dent in that, not only from a person's life perspective, but from the economic and the impact on society? It could be quite huge. So we're optimistic, and that's kind of where we're focused. And why we're focused on treatment-resistant depression is this is the most pernicious thing. This is the hardest thing to deal with. So we take a long view. It's interesting. I was reflecting. This is my 5th startup. And so what was interesting is kind of the different vantage points of starting something. My first was in my 20s, then another 30s, 40s, 50s, now 60s. And so what's interesting is a different vantage point, kind of as an OPOer now. Old present, sorry, to those of you. This is really, it's the first time I've done something that is a vision that's going to outlive me, and that's really cool. It's really cool. So it's a much lighter touch on what leadership means. It's more about casting and getting the next generation into this, so this has longevity. So a little bit about the science and why we got interested. This is a really busy slide. The headline of this slide is, there have been a bunch of small academic studies. The small academic studies have all indicated that if you take a big high dose, a macro dose, not a micro dose, under a safe, supportive environment, what happens is there is an immediate and sustained benefit if you have depression. And that sustained benefit can run for 5 weeks, 6 weeks, 6 months. In a pilot study we helped support at London Imperial, 27% of people at 12 months had no more psychotherapy or pharmacotherapy after an average of 18 years of depression and an average of 5 failed treatments. Uncontrolled study, but interesting signals in the wind. And that's what these are. These are signals. And so the signals are really important because they're things that say, well, why aren't we going to go pursue this? Now, pursuing it is a really expensive thing because you have to go from getting an approval if you're going to expose 50 people to a trial of psilocybin to we're about ready. We're operating right now in 13 countries. Actually, we're working in 13 countries. We have approvals in 11 right now. And so when we look at the aggregate populations, we're now not exposing 50 people, but potentially exposing 700 or 800 million. And so when you start looking at those numbers, you have to do your homework in a different fashion because the responsibility is quite high. And this kind of gets us to why I'm a regulatory geek. I spent 7 years working with regulators around the world. And what I found was that what's really interesting about regulators, they're people who sign up to low-paying jobs for their career because they really care about public health. And they really care about making sure that what gets brought to patients and what we say is a benefit actually has some evidence behind it. And that's true on both sides of the Atlantic and Asia Pacific and worldwide. And so I want to give you 2 instances that are separated by about 120, 130 years. One was the use of snake oil, which was very popular out here in the West. And it could do everything from fix your marriages to your rheumatism to you name it. And there were people marketing it. And sometimes snake oil was better than other snake oil, and some people were getting hurt by it. And this was really the birth of regulation, was when people who were saying, I'm going to be helped by something, actually were harmed by it. And there was a sense that what we need to do is if somebody is saying, I'm going to help you, we need to have a little evidence about that, thank you. I'm going to fast forward, and now this slide, time date stamp, this was done for a presentation in early October. The numbers now are 2,447. Okay? This is an area that, in terms of vaping deaths, this is an area where actually our Scott Gottlieb, who's the former head of the FDA, really thought that there should be regulation around vaping. We had a disagreement with the administration and fell on a sword. He's no longer doing that. And he's left the FDA. But what happens when you have the animal instincts of capitalism, sometimes you kind of skip over the hard parts of, am I going to harm somebody? And the Hippocratic Oath is, above all, do no harm. And the role of regulation is really, to the best extent, how do we make sure that we're not going to harm people? And that's why right now, when you see all of the efforts here at Ground Zero for, psilocybin decriminalization, which I think is an important thing, people shouldn't go to jail. But do we really have enough information, enough evidence to be doing this at scale? And the answer clearly is no. We have only a couple hundred trials, people in trials, not a couple hundred trials. So our view is really, how do we bring world-class evidence and answer the hard questions of, can people with treatment resistance depression in the highest quality standards in 9 countries right now, going to 11, how do we get them to really develop that knowledge? And hello, there we are. What regulators do, don't worry, we're not going to get into a regulatory conversation. I just want to give you a little bit of kind of a view of this. Regulators do 3 things. First, they look at the quality of what's being manufactured. So if you're making a medicine, the medicine better be the same in Aspen as it is in Amsterdam, as it is in Albuquerque, as it is in Azerbaijan. You have to have a global supply that meets the highest quality standards, and it has to be stable. You have to know when it expires. You have to know that it's going to be the same substance, and you have to know what the doses are for people. And that means you have to do trials. And then the other 2 aspects, so quality product, and then you have this balance of benefit and risk. And what regulators do is they look at, is the benefit greater than the risk for a particular group of people? Cancer medicines are always tried when people are at their worst place, because the harm of a really difficult chemotherapy in light of somebody who's about to die is much lower than giving to somebody who's had a stage 1 breast cancer. You don't want to do that because the benefit risks are out of balance. So what regulators always do is they think about this balance between who should we try to demonstrate this on, and is the benefit going to be more than the risk? And by the way, everything has risks. There is no panacea. You drink too much water. When you have a great MDMA session, you can die of hypernatremia. So there you have it, that was water. So I think this balancing act is really important. And that's why we focused on treatment-resistant depression, because it's a really dire condition. And then we're looking at the benefits for those people with the relatively low risks of psilocybin. And that's what the FDA has agreed with us on, and as well as the European Medicines Agency and all those other countries I mentioned, ranging from Denmark to Czech Republic, Portugal, et cetera, where we're doing our trials. I didn't go into a lot of detail around all our trials. Maybe I'll talk a little bit about that. On Wednesday next week, we're about to announce the results of the largest psychedelic placebo-controlled trial ever done in history with psilocybin. That would be 90 people. And bringing kind of this YPO, we're a little bit of the Green Berets of clinical trials. So we're about execution. And we did that from conceptualization to readout in 18 months with 90 people with really significant innovation at the Institute of Psychiatry in London. And so our whole view, and I think one of the benefits that we've brought to this space, is kind of mainstreaming this in a funny way, where I would characterize, Rick invited me to come to the Psychedelic Science Conference in 2017. And I brought Tom Insel and Paul Summergrad, and we had a conversation, which was kind of a bridge building to the psychedelic community of, if we want to bring this forward into society, we have to play the game. And it's not a game, it's people's lives, and do it right. So we're now doing clinical trials. That trial will report out. It was with healthy volunteers. And the problem is, this problem is huge. So how do you actually get this to be affordable? Right now, there's no problem if you want to fire up the G650, whatever plane you have. You can go any place in the world. You can spend $5,000 for free mushrooms and have a great experience. And that happens. But what about people like the guy in Dublin a couple of weeks ago who we had in a trial, who was in graduate school, left graduate school 17 years ago, moved home, and has never left his house? they don't have the resources. So everything we're doing from day one is about access, Medicaid, Medicare, NHS. The reason I moved to England was to work where health is a right, not a privilege, to work on this kind of purely. So I'm going to just end by saying what's happening in our trial. We're doing a phase 2B trial. This is a trial where we have to demonstrate what is the safe dose. You've already gone through this, but that's what's needed now. You never want to give somebody more of a substance than they need. So we're doing a 10 and a 25 milligram dose, and we're seeing what that's going to be like. You know, do you have people who benefit from a 10? They don't need 25, and therefore they don't have to go through the extra pressure of a large dose. And for those of you at home, our 10 milligram dose is equal to about 1.75 gram and 3/4 of magic mushrooms, cubensis, and then the big dose is about 4.5 grams. So these are big doses. And we provide support for them, a trained therapist. We have a 150-page therapy manual. We've approved by the FDA and regulatory agencies around the world. People really benefit from the sense of connectedness and gratitude. It's a really interesting thing. What do you do when you come out of this? People have an instant response for those who respond. And by the way, not everybody responds. Not everybody responds. It's really important. It's actually good news because then we know it's real. Treatment rooms. This is one of our treatment rooms. And it's just, you know, someone there supported. We have mindfolds. These are masks. It's like an international flight. So people have an inner experience. This isn't going out in nature and having a good time. This is really kind of going deep in. People have a sense of transcendence, a connection to something much bigger. These masks have rubber around them so people's eyes can be open while they're having it. We're finding when we take the mask after the 7 hours, quite often there's a little line of white salt from the tears. People find it. Sorry. People find it so moving. This is a medicine that Hopkins did this amazing thing. They asked for some reason, tell me at the end of this 5 weeks after the session, could you say how meaningful this experience was for you? And what they found was nearly 2/3 of the people, after they said, well, what do you mean by meaningful? Do you know Christmas with a family or what? And they said, no, kind of, let's raise the bar a little bit. What about the birth of your first child, your marriage, death of a parent, that kind of meaningful? So 2/3 of people who had this experience 5 weeks after said it was one of the top 5 experiences of their life. 1/3 said it was the most meaningful experience of their life. And guess what? The numbers held at 6 months, okay? So we're talking about something truly hugely important. So what I thought I'd do is share with you a 2.5 minute, which is about a 3-minute thing of how do you tell someone who's about to go through their first psychedelic experience, how do you train it and give a sense of what's going to happen? And this is approved by regulators around the world, so that's kind of cool. And here we go. And then that'll be the end. Or, there we are. Could we have the volume?
Psilocybin has been used safely in hundreds of research sessions in the past decade. Some participants in previous studies have described the experience as being like a journey down a river. Each journey is different, and you won't be alone. Your therapist will be with you. In the beginning, as psilocybin starts to activate different areas of your brain, you may feel some unusual physical sensations, like being hot or cold, vibrations in your body, or visual distortions. This is just the drug taking effect. Be open and curious about any sensations in your body. Focus on the sound and rhythm of your breathing. You may feel shifts in your emotions. They can change quite quickly, like the weather. allow yourself to experience them fully. You may have unusual visions. They can be beautiful or challenging. You may encounter old memories or thoughts of the future. You may wish to stop and explore, or to keep going. Try not to resist the experience. Allow yourself to go with the flow, in and through. Your guide is there for support. Your journey may be short or may last for several hours. On your return, your support team will be there to welcome you back and hear about your experience.
This is a statement from someone in the, one of the trials. And I probably will end here that, Rick shared a lot about his organizational structure. We looked at this really long and hard. We started off as a nonprofit. We never took anyone else's money, but we did a lot of donation to science. Then we met with the European Medicines Agency, interestingly enough, using the process that I'd co-created with them 6 years before, never knowing about psilocybin or psychedelics at that time. And they said, are you able to deal with something that will be affecting tens of millions of people? And when we started to do the math, I quickly picked up the phone and called a friend of mine, Tom Tierney, who's also what used to be a YPO, who's the chairman of the Bain Consulting Group and now the chairman of Bridgespan, and Bill and Melinda Gates, philanthropic advisor. And I said, we don't know what to do. We think we're going to have to raise a lot of money, and we didn't know it's hundreds of millions to do what we're doing. And he said, look, I have 3 tests for you. And this is a place which Rick didn't have the benefit of. Rick did so much of the kind of groundbreaking work here. And the tests were, look, is there a product? Yes. Is there a customer? Well, actually, there are quite a few of them. There are patients, there's health systems and pharmacies, et cetera. And then he said, is there a path to that to get the product to the patient? And I said, yeah. And he said, well, look, there's no market failure here. And his view was a fairly standard one of, if you have all of these things in place, the cost of capital is much higher as a nonprofit. So actually do for-profit. So we are a for-profit company, what we believe is an ethical company, looking at how we're going to have this be affordable. We're already working with payers and the NHS and everyone else to have this be affordable. Part of what we've been doing in our first clinical trial was demonstrating how we can do this with 1 therapist per person, a supervising therapist, and 6 simultaneous sessions. So, and we're just on Wednesday, we opened up the first psych-oncology clinic, which will be a psychedelic clinic outside of Rockville or outside of Washington, D.C. We're opening another one in La Jolla where we'll be training therapists and doing more studies. And we've raised $55 million so far, and we're about ready to close another 50 so that we can start going the distance. We're working on not only treatment-resistant depression, but a number of other areas. We really want to do the science and get here. So that's me. Actually, that's my story. It's not me. We have an amazing team. Just an amazing team of people working on this. They're just 40 in our because we're younger than you are. But we have about 150 people working on this project in all these different countries. Therapists, principal investigators, academics, and a lot of really talented people in our organization who have experience bringing medicines to patients. So that's us.
Thank you for your vulnerability as well. It's not an easy topic to talk about. Thank you. I'm going to keep this brief. I want to open it up to questions in a few minutes. I'm sure you're all eager to ask both Rick and George questions. I really was originally intended to come here for two reasons. One, as an advocate of the research, and just to encourage curiosity and open-mindedness in this, what can sometimes feel like a controversial space. And then the second reason I'm here is as a trauma therapist. I have, like most clinicians, I entered into this work through healing my own trauma. And I think through that process, I really discovered how pervasive this thing that is called trauma is. It is our biggest public health crisis. It is at the root of everything. It's at the root of our mental health issues and at the root of our physical health issues. And so I'm all about let's get to the heart of the issue. I was in treatment in my early 20s, and I had suffered with chronic debilitating anxiety, and I self-medicated, and I ended up in treatment, and I presented as a drug addict, but I don't identify as one. I was traumatized, and I needed trauma treatment, and so I think oftentimes we're so focused on the symptoms without addressing the underlying issue. And I was actually surprised when George led us in this exercise. I assumed every single person in the room would raise their hand, because I actually don't think it's possible to be a human being and not experience trauma. And so I think one of the things we need to do is educate people about what trauma is, and how it becomes the filter through which we view our reality and live our lives. It becomes the kind of foundation for how we connect with people and what our relationships look like. And so it's really, really important that we address it, and that we all kind of start to take responsibility for addressing our own experiences of trauma when we have the capacity to do so. I was at the MAPS training recently, and it was such a wonderful experience. I can't tell you what it was like to be for 10 days with 50 scientists and mental health care providers and artists and people that are all share a mission to heal trauma and to make a difference on the planet. And I have so much that I could say, but I'm going to keep it brief. So as I was thinking about what I could share, there were three things that really stood out to me. One is regarding time. You kind of were speaking quickly, so he mentioned this, but I want to emphasize this. When we are working with treatment-resistant depression, anxiety, or trauma, it takes a very long time to get to the heart of the issue, to start to experience transformation. Psychedelic psychotherapy has shown, when effective, as George mentioned, it's not always effective, but when effective, to speed the process up. And because there is a sense of urgency, right, given how pervasive mental health issues are in our country and on our planet, we really don't have as much time as we would like to have. So in the interest of time, I think it's really important that we pay close attention to the potential that these medicines have to offer us in the mental health space. The second piece I will mention is this concept of a transpersonal experience. I had resources when I went into treatment and was able to do a lot of searching. And I thankfully found some really powerful, wonderful teachers and healers, and have been able to, I was educated about how to do my own work. As George mentioned, not everybody has that kind of access. But the spiritual part of my journey was by far the most transformative. And psychedelics have the capacity to really help us loosen our grip on the material world. We human beings have really strong egos, and we tend to rely heavily on what we can see with the eye. And I think, for some of us that are on a spiritual journey and have a mindfulness practice, it's a more natural process to access kind of a greater sense of meaning and purpose, a deeper understanding of how connected we all are. But for some people with treatment-resistant conditions, that is not a possibility. I have clients that come in that sit in front of me and we start with a meditation and it's clear, like, this is not doing anything. And so I think the transpersonal experiences that are available to people through psychedelic psychotherapy are really important, and integrating them is a big part of the healing process. The third piece I want to reference that MAPS focuses on, and I had the chance actually at MAPS to train with one of George's lead researchers at Compass. He was with us there, Brian Richards, who I've come to know and love. And so there are a lot of similarities in the treatment. But at MAPS, they refer to something called the inner healing intelligence. And we are all endowed with an inner wisdom. We are endowed with an intelligence, right? So much like the physical body, when it's under attack with disease, it jumps into action. The immune system, the healthy cells are doing the best they can to treat the illness, right? We tend towards wholeness. The mind works in a similar way. We experience trauma, and oftentimes that does rupture the integrative fibers of the brain. We develop all sorts of maladaptive coping strategies, like addiction, like depression, that are actually designed to protect us. It is our mind attempting to protect us from further suffering. And so it's creative. And really what we need is to access the wisdom inside of ourselves to be able to recognize those maladaptive coping strategies and shift them. And psychedelics create the conditions, right? They are the medicine that just create the conditions. The psychotherapist in the room is really there to create a container to make you feel safe and supported and to let you know that you're okay. But you, as the participant, we don't call them patients, are the healer. You do your own healing work. You have your own unique experience. You have your own unique story of trauma and suffering. And however that comes to light in these psychedelic experiences, none of us can predict. But what we know is that we can support participants with the process. And, as I believe so deeply in the inner healing intelligence. I think all of us have this. We have access to it right now. And it's all about allowing that kind of wisdom inside of us to emerge and do the work. Those are kind of the three things I wanted to share about MAPS. I had an incredible experience, and I'm so grateful. And I am now going to open the floor for Q&A.